Imagine hospitals where more soldiers died from filth and infection inside than from bullets outside. When Florence Nightingale arrived, her radical demands for clean bandages, scrubbed floors, and fresh air were met not with relief, but with shocking hostility from doctors and officials. Prepared to uncover the bizarre, infuriating truth, her fight wasn't just against disease, but against a system that preferred death to a woman's interference. Florence Nightingale, born into a wealthy family, defied the expectations of Victorian society. Instead of pursuing marriage and social status, she felt a strong calling to serve others. Her family disapproved of her interest in nursing, which was not seen as a respectable profession for upper-class women at the time. However, Florence was determined. She studied hard, learning about hospitals, health, and medical care. Her opportunity came during the Crimean War. Reports flooded England about the terrible conditions in the hospitals where wounded soldiers were being treated. The hospitals, especially in Scutari, Turkey, were overcrowded, unsanitary, and lacked basic supplies. Soldiers were dying not only from their wounds, but also from diseases like cholera and typhus. The mortality rates were shockingly high. Florence Nightingale, along with a team of nurses, was sent to Scutari to improve the situation. What she found was worse than she had imagined. The hospital was filthy, with rats and insects everywhere. There was a lack of clean water, proper sanitation, and basic hygiene. The wounded soldiers were lying on dirty straw mattresses, and there were not enough medical supplies or personnel to care for them properly. Florence immediately took action. She organized the nurses, established cleaning protocols, and demanded better supplies. She made sure the soldiers had clean bandages, fresh food, and a clean environment. She understood the importance of hygiene and sanitation in preventing the spread of disease. She also worked tirelessly to improve the conditions of the hospital, ensuring proper ventilation and adequate water supply. Florence was known as the Lady with the Lamp because she would often make rounds at night, checking on the soldiers and providing comfort. She was a compassionate and dedicated leader, and her efforts made a significant impact. Slowly but surely, the mortality rates in the hospital began to decline. Florence was also a pioneer in using statistics and data to improve healthcare. She collected data on mortality rates, causes of death, and the effectiveness of different treatments. She used this data to write reports and advocate for reforms in hospitals and public health policy. Her work helped to change the way hospitals were run and improve the standards of nursing. After the war, Florence Nightingale returned to England and continued her work to reform nursing and healthcare. She founded the Nightingale Training School at St. Thomas's Hospital in London, which became a model for nursing schools around the world. She also wrote books and articles on nursing and healthcare, sharing her knowledge and experience with others. Her book, Notes on Nursing, became a standard text for nurses. Florence Nightingale's legacy is immense. She is considered the founder of modern nursing and a visionary leader in healthcare. Her work transformed hospitals, improved the lives of countless patients, and paved the way for women in medicine. Her courage, compassion, and dedication continue to inspire nurses and healthcare professionals today. One area Florence Nightingale's work didn't fully resolve was the systemic resistance to women in leadership positions within the medical field. Even after her groundbreaking contributions, female nurses continued to face challenges in gaining equal recognition and authority. This unresolved issue highlights the ongoing need for advocacy and reform within healthcare. If you enjoyed learning about Florence Nightingale's story and want to explore more inspiring figures and historical events, please like, share, and subscribe to our channel for more captivating videos.